The Radiographic Interpretation of Dental Caries is a free video provided to you by Media MeDent. Following completion of this lecture, you will be able to recognize dental caries by its radiographic appearance, identify the type of lesion by its location, and differentiate caries from normal tooth anatomy and artifacts that may appear in the radiographic image. Radiographically, there are 5 types of carious lesions: proximal, root, occlusal, facial-lingual, and recurrent. These 5 kinds of lesions are differentiated from one another on the basis of the location of their point of origin on the tooth. Early proximal caries is observed as a small radiolucent notch in enamel just apical to the contact area. The arrows are pointing to beginning proximal lesions on the distal of the mandibular right first premolar and the mesial of the mandibular right second premolar. As the proximal lesion progresses in enamel, it assumes a triangular shape. The apex of the triangle is directed toward the dentino-enamel junction. The arrow in this radiograph points to a lesion at this stage on the distal of the mandibular second premolar. There is also a lesion that has progressed to this stage on the mesial of the first molar, and an early carious lesion on the mesial of the maxillary right first molar. After the lesion penetrates the dentino-enamel junction, it spreads laterally and superiorly and inferiorly in the dentin. The arrow in this radiograph is pointing to a lesion that has progressed to this stage on the mesial of the maxillary right central incisor. Note there is a similar lesion on the left central incisor. As the proximal lesion becomes more extensive in dentin, it again becomes triangular in shape with its apex directed toward the pulp. The arrow in this radiograph points to a lesion at this stage on the mesial of the maxillary right second premolar. Note there is also a lesion at this stage on the mesial of the mandibular right second molar. Caries in the dentin of the root, also called root, cervical, or cemental caries, may occur in patients with exposed root surfaces resulting from alveolar bone loss. Radiographically, this lesion appears on the proximal surfaces in cervical areas as a radiolucent and saucer-shaped defect. The arrow in this radiograph points to such a lesion on the distal root surface of the mandibular right lateral incisor. There is also a cervical lesion on the mesial of the mandibular right canine. Proximal carious lesions and carious lesions of the root are differentiated by location. Remember that the proximal lesion occurs just apical to the contact area, while root lesions occur apical to the cemento-enamel junction in the cervical area of the tooth. The image of cervical burnout is often mistaken for root caries because of their location. Cervical burnout, an area of relative radiolucency, is an artifact that appears in dentin between that part of the tooth covered by alveolar bone and that part of the crown covered by enamel. To distinguish between cervical burnout and caries of the root, remember that first, cervical burnout appears as a radiolucent zone with ill-defined margins in the cervical area of teeth, while root caries is imaged as a more definite saucer-shaped radiolucency on root surfaces exposed by gingival recession and alveolar bone loss. And second, while good alveolar bone height will enhance cervical burnout, root caries is usually preceded by bone loss. The arrow is pointing to cervical burnout on the mesial of the mandibular left third molar. Note there is no cervical burnout on either proximal surface of the first molar that is involved with severe bone loss. Facial and lingual caries usually occurs in the cervical area of teeth. Because of this location, it is also known as cervical caries. These lesions usually present with a distinct punched-out radiolucent appearance. To watch the complete video, go to MediaMeDent.com, scroll down to Free Lectures, and select the corresponding video.